Okay, so here if I say the stage 3 and 4, okay, stage 1 and 2 I had completed in the last video. You can see over there when the individuals are at the point of stage 3, they shows signals of psychological damage and they are moderately ill. They may experience negative feeling. Just wait a minute. Okay, so where I was nearby here. So basically, in stage 3, whenever the individuals are there, they will be they show sign of psychological damage and they will be moderately ill. Which means in the stage 1 we have seen that the person is extremely healthy, but in the stage 2 they are not. In the stage 3 they are moderately unhealthy, which means they are damaged and ill. They may experience a negative feeling like sadness, fear, inadvocacy. Okay, so the person who in the stage 3 they will feel sad, they will feel fear, they will feel inadvocacy, irrational. In stage 2 also they will feel it, but here more. They may lack motivation to take up a new challenge. So basically these individuals are not able to take a challenges, like when you are in the even this is happening with all of us. We are not able to take a new challenges. At that time we are in the stage 3. Okay, sometimes they feel overall apathy and feel tired even while completing their daily routine or work, and the relationship may get strained and they may even turn towards drug abuse and alcohol. And though they show clear signs of mental illness, and they may still be productive and functioning properly, but may find difficult to do it. But this point is also not irreversible. By consciously trying to find the realistic root cause of the stress and with the help of emotional support, such individuals can fight with the moderate illness and they are facing. They can get emotional support either from family and friends, or at times they may need professional help. Which is basically they are saying that first of all we need to understand there are 4 stages are there. Each one of us in this world, we are there sometime in stage 1, sometime in stage 2, stage 3. Even we are not able to participate in some activities where, and at that time we are in the stage 3 because we are feeling shy. Okay, so basically if the person in stage 3 they require a lot of professional help, even the family support, and this stage is irreversible. Clear? Is not irreversible. So in stage 4, individuals show clear signs of psychological disorder. They show extreme distress, impairment in all 3 areas of functioning, example mental, emotional and social, and they need professional care and treatment. Okay, they need professional care and treatment. Clear? If I show like they show extreme distress and impairment in all 3 areas of functioning, like if the person is in stage 4, like their mental is not proper, they are emotionally is not proper, not maintained, they have a social issue, societal problem they will have. Clear? Now the criteria for psychological disorder. What are the criteria for psychological disorder? There are certain criteria are there, and that criteria needs to be understood by the people, right? Like for example, if I say if you want to take admission in 12th standard or higher education, there are certain criteria are there. If you want to do MBBS education, like you have to pass the NEET exam. So if a person is having a psychological disorder, there are certain criteria which is set by the standardized program. An individual keeps shifting from one stage to another depending on his or her life circumstances. Okay, an individual keep shifting from one stage to another depending on his or life circumstances, which means that we are individual, I am individual, you are individual. Your life, you are shifting from one stage to another, like four stage we have discussed, according to your circumstances. Like according to my circumstances, I will be in the stage 3 or you will be in the stage 4 according to a situation, right? After a few months you will be in the stage 1 and I will be in the stage 4. In such situation, how do we decide whether a particular person is suffering from any psychological disorder or not? Which means they are saying that in this situation, how we can understand like we are having a psychological disorder or not. Okay, the mental health professional currently use the diagnostic procedure to make such decision, which means if we need to understand like we are having a psychological disorder of all the other person is having, so we cannot know, but the psychologist or professional mental health professional, they are using a diagnostic tool procedure to know that, okay, to take that decision. For this purpose, generally DSM, diagnostic statistic module, and ICD, okay, criteria are currently used to know this if a person is having a psychological disorder. According to the present DSM-5, there are 5 criteria for psychological disorder. Okay, how many criteria are there? If the particular person is fulfilling those 5 criteria, so we can say that that particular person is having a psychological disorder. Let us study them in detail. The first one is clinically significant syndrome. Okay, so clinically significant syndrome, what is mean? The first criteria, if we want to know that person is having a psychological disorder, so this criteria should be fulfilled. Significant syndrome, significant means something unique syndrome should be there. When we have some physical symptoms or complaints, we know that we are ill. In the same way, in psychological disorder, there are certain patterns of important behavioral and psychological syndrome that are occur in an individual. There are certain symptoms that occur together in a particular disorder, which means that whenever in your body, if you are feeling a weird, because if your hand is paining, your leg is paining, that are the physical symptom, right, of your particular that you are ill. But in psychological also there are certain symptoms and patterns are there. Okay, behavioral and psychological syndromes, there are certain symptoms that occur together in a particular disorder, and this cluster symptom called syndrome is nothing but there are certain behaviors and certain symptoms occurs together, and that is when these particular symptoms occur together, that is called a syndrome. Psychologists rely on this syndrome to diagnose their disorder. Psychologists depends on the syndrome only to diagnose that. We will study about this syndrome in the section where we will examine the psychology. In short, I can say that like if your head is paining, okay, that is one symptom, and second is if you are having a cough, if you are having a nausea, so we can say these 3 things if I combine, so it will become a syndrome, and that is syndrome of your fever. So like this, the psychologists are dependent on the syndrome to treat the patient who is having a psychological disorder. Okay, the first is the syndrome, clear, clinically significant syndrome. Second one is distress and impairment, clear. Second one is what? Distress and impairment. There should be a presence of distress or impairment, which means that the person should having a distress or impairment, and we have already learned about distress as well as impairment in 11th standard, clear. So there should be a presence, okay, presence of distress or impairment, and we have already learned about distress as well as impairment in 12th standard, clear. And distress is the psychological pain. If I talk about, if second criteria is nothing but the person should be in total stress and impaired, okay, then we can say that the person is having a psychological pain. The pain may arise due to the negative feelings. How this pain is arising? Because of sad, because of fear, because of inadvocacy, because of restlessness, irritability. Sadness means like you are sad. Fear, everyone know. Inadvocacy, like you are not able to do your work. Restlessness, you are feeling restless, like you are not feeling okay. right? You are irritated, you are tortured, you are frustrated, and it may also due to stress. Impairment is difficult to perform appropriate duties and roles in personal, social, and work related situations. Impairment is nothing but you are not able to do a daily routine your work, clear? And dysfunction, if the symptoms leads to an underlying psychological, biological, or developmental dysfunction, that it leads to the diagnosis or mental disorder. So the third criteria of a psychological, first criteria, there should be a syndrome. Second criteria, impairment in daily routine, the person will not able to work, will perform their work. Dysfunction, function means I am functioning. Dysfunction, that particular thing is not functioning. If the symptoms lead to an underlying psychological or biological developmental disorder, psychological dysfunction, biological dysfunction, and developmental dysfunction, then lead to the mental disorder. Example, inability to remember, inability to learn. So basically, if you see in the example, if the person is not able to remember, person is not able to learn, person is not able to concentrate in a one activity or whatever way, like right now you are listening, you have a concentration, right now you all are listening, you have a concentration, okay? So you don't need to worry about it. Now let's focus on the fourth criteria, right? If any response given to the stressor, okay, fourth criteria is not, if any response given to the stressor or losses are accepted as a response to the situation, do not consider a sign of mental disorder. It should not be a response that is normally given to a common stressor and losses, or it should not be culturally sanctioned response particular event, which means they are saying that fourth criteria is, if any response given to the stressor means what? I am feeling sad because no one is there. So no one is there in my home, that will become a stressor, right? So you are in the school, in college, sometime your teacher is the stressor, sometime your friend is the stressor, sometime a particular thing. So if any response when given to a stressor or losses or loss are accepted as a response to that situation, it is not considered as a sign of mental disorder. Fourth criteria is nothing but we cannot say that particular thing is sign of disorder because the particular person is responding to a particular thing, sadness or stressor, or it should not be culturally sanctioned. And fifth, any behavior which is just deviant or conflicting with society but not producing dysfunction or distress or disability, then it does not become a sign of mental disorder, clear? And they are saying that first three, they are saying this criteria, fourth and fifth, there are exceptions are there, like any behavior which is just a deviant, any behavior which is not acceptable or conflicting with the society but not producing dysfunction or distress, so then it is not sign. So if any behavior which is not acceptable in society, like for example a person is drinking alcohol, that is not acceptable, but the person is function, that the person brain is working, that we cannot say the mental disorder. Behavior should not be solely be a result of social culture deviance. For example, in a certain society culture, homosexuality is considered abnormal behavior, but according to it is not a sign of disorder, okay? In short, the psychological disorder or mental illness is a condition of clinical syndrome which involves changes in emotion, thinking, and behavior, or combination such that leads to the stress, dysfunction, and all. So they are saying that these are the five criteria that it makes the person completely, the person is qualifying this. If any person is qualifying this criteria, there is a high level of chances that person will be that person really have a psychological disorder. As a, like till now you need to focus on that person shows the clinical syndrome, there should be some behavior impairment, not able to function well, dysfunction, not able to remember, right? And then mental illness, I will start with, I am stopping here, okay?